All right. Hello, everyone. My name is DePaul Straub. I'm the Assistant Director here at Mines for New Student and Transition Services. I am happy to present this welcome webinar series this summer with a variety of different campus partners and some of our students as well. So thank you all for coming out and joining us for our first one. Today we're going to talk a little bit about student health and wellness. So that's going to cover everything from student health insurance to the health center, the counseling center, health and wellness promotions, all of those great things to learn how to stay kind of healthy and well at Minds. So I just want to kind of put out a couple things really quickly before we get started. So you'll notice that because we're in the webinar feature, the chat is disabled, but we do have that lovely Q&A feature. So if you click on that Q&A feature, it'll allow you to kind of type a question and send it to us. We will be tracking those throughout. We have a couple of our Nest staff members in the background tracking those as we go. So if you see Jessica Clark or Ronan in the background, they will be kind of helping to answer some of those questions in that questions tab. But please know that if you submit a question and it doesn't get answered in chat, that just means that we're saving it for the end. So we'll let all of our presenters present, and then we'll kind of do a Q&A at the end where we can ask questions that are applicable to everybody so we can make sure that we get those answers to you. So again, we'll be answering some of those in chat, but some of them we'll save for the end. But please know that we are seeing your questions, and feel free to submit those kind of as we go throughout. So with that being said, I'm gonna go ahead and jump right on in, and we're gonna start off with our student health insurance program. So I'm gonna introduce Andrea.
Hi, everyone. I'm Andrea Tangney. I manage the student health insurance plan. Just here to tell you a little bit about the plan, the enrollment waiver process, deadlines, all those good things. So SHIP runs annually from August 1st through July 31st. So there's never a lapse in coverage. So it will cover you during breaks and holidays as well, if you live in the US. Our student health insurance plan is covered through United Healthcare. It uses the nationwide Choice Plus PPO network, and it has in-network providers throughout the country. For the benefit of all of our students, it is a requirement that mine students all have comprehensive medical health insurance. You can have it through your own plan, a spouse or a parent, or if you use our plan here. Each semester, you'll be charged for the SHIP. If you waive, you'll also see a corresponding waiver credit on your account. So that health insurance charge does not go away when you waive, but the corresponding waiver credit balances it out. Whether you choose to enroll or waive in fall, your selection is binding for the entire academic year. So if in fall you choose to enroll, you'll be enrolled through July 31st of next year. SHIP has really good benefits. There's no deductible. The out-of-pocket maximum for the planned year is $2,000. Preventative care is free. The plan is Affordable Care Act compliant. And they also offer United Healthcare's Student Resources app, which you can view your digital ID card, you can see claims, and you can find in-network providers. So Academic Live Care is a virtual resource we provide for all of our Mind students, whether they're on SHIP or not. It is a telehealth that's available 24/7. They offer nutrition consultations, mental health visits, medical care visits, and it's a great resource because you can use it any time of day. And currently, you can scan that QR code and you can get coverage beginning August 1st. I was informed that they're going to be changing the process in early September and that the process will be a little bit different, but they're going to email every student and let them know the new process. But if you need this resource between August 1st and beginning of September, you're welcome to use this with the service code ALC and the coupon code LiveCareMinds24. There is also optional dental insurance. This can be purchased through our insurance broker, Academic Health Plans. They offer this when you enroll in SHIP. It is not affiliated with Minds in any way. Just so you know, we are not able to offer a plan through Minds, unfortunately, because it would increase the cost for everyone. But this is a really good plan if you want to look into it. But there are also other dental insurances as well if you'd like to be covered through that. If you choose not to purchase a dental insurance plan, there is an on-campus dentist that I'm sure the Student Health Center will talk more about. So enrollment begins July 15th, and it's an online process. The website is csm.myahpcare.com. All students who are enrolled in at least one credit hour are charged for SHIP. If you're wanting to enroll, fantastic. You'll just go onto that website, do a few simple steps, and then you'll be enrolled for the full academic year. The deadline is September 3rd, which is also the add drop date. So make sure to mark that in your calendar. That's an important date for a lot of departments, not just mine. So if you already have your own insurance plan and it's great and it's going to cover you in Colorado, fantastic. You'll just need to waive SHIP coverage. It's the same website that you would go to enroll, the csm.myahpcare.com. We have three main criteria that your insurance plan must meet. You must have active coverage that's in effect from the first day of classes through the full academic year. Your insurance plan must be Affordable Care Act compliant, so it cannot contain a pre-existing conditions clause. It can't have limits on the financial how much United Healthcare will pay. It can't have limits on that. And you also have to have providers in the Denver metro area that cover everything from preventative care to doctor visits, specialist care, all the way up to major emergency situations. So you can also find the waiver information on our website. It is this site here. Sorry, it's hard for me to read that on this screen. It's on the enrollment waivers and requirements for the SHIP page on our website. And this has the things that your plan has to have, and it also has the things that your plan can't have. For example, we can accept Colorado Medicaid, but we can't accept other states' Medicaid because other states' Medicaid will not cover you in Colorado. So you're welcome to look at that before the enrollment waiver period opens. Once it does open, definitely if you're unsure about your insurance, just go ahead and send it, and Academic Health Plans will let you know if it meets the criteria or not. All right, so again, waiver process begins July 15th. Students with approved waivers will also receive that waiver credit. Something to note, a lot of times on the statement you get from the bursar's office, the waiver credit and the health insurance fee will not be side by side. So you'll need to just scan the bill to see the 2906 charge and then the negative 2906 to balance it out. Okay. Oh, you only need to waive once each academic year. So when you waive in fall, the waiver covers you all the way through July 31st. Again, the deadline is the add drop date, which is September 3rd. Just, just to reiterate once again, the website is csm.myahpcare.com. The deadline is September 3rd. Once you are eligible to waive or enroll SHIP, your student or you will receive an email from me with an attached step-by-step guide on how to both waive or enroll. The email will also have all this information I've been talking about. It will have the cost, the coverage dates, that it's through United Healthcare Student Resources. And then any questions you have, you can feel free to reach out to me. Just respond to the email I send you with questions or look at the several SHIP web pages. We do have a frequently asked questions page. That's really helpful. So definitely check that out. Hopefully that can answer any questions that you have. So yeah, questions, you can email me if you've looked at the website, you've looked at the email I've sent, you're still unsure about something. It's just ship@mines.edu. And any kind of insurance questions that are very specific, like will the plan cover this medication? Can I go to this number of physical therapy visits, things like that? Those would all be directed to United Healthcare. So you can contact United Healthcare Student Resources. Their customer service line is 800-767-0700, and they'd be able to answer the more in-depth questions about them. All right, I will be available at the end of this webinar for any questions you have. Thank you.
Thanks, Andrea. So again, just for those of you who may be joining late, feel free to ask questions at any time in our Q&A feature. Please know that like once you submit that, we are seeing that on the back end. We are purposely holding some of those to be able to answer for everybody once we get towards the end. So with that, we will keep on moving along, and I'm going to introduce Callie to talk a little bit about our Student Health Center.
Hi, everyone. I'm Callie. I'm a nurse practitioner in the Student Health Center on campus, and I'm just going to kind of review our services and tell you a little bit more about us today. So, like they said, just feel free to throw any questions in the Q&A section. Okay, so we are the Student Health Service. That's our waiting room there in that picture. Our hours, our typical hours are listed there, and our website. Our website is the best place to find our hours, any additional information. There's a lot of detailed information on our website. So if you don't remember anything I said, just remember that the website exists, and that's a great place to go for any answers. Okay, so we are located on the very first floor of the Wellness Center. The Wellness Center is a building that holds most of the services that you're going to hear about today. And when you walk in those double doors on the ground level, you walk straight ahead, and there we are. We're on that first floor. Okay, there we are. So that is us. We are staffed with nurse practitioners, a physician assistant, a consulting physician, medical assistants, a psychiatric nurse practitioner, a registered nurse, and our wonderful administrative staff. So services that we provide, we're basically like a primary care office. So anything that you would typically go to a regular primary care or pediatrician for, we usually provide that service. So illness and minor injuries, physical exams, preventative care exams, including routine wellness and gynecologic exams. We do have on-site laboratory and point of care testing, so rapid strep, rapid flu, urine samples, urine pregnancy tests, mono testing, etc. We also have the ability to draw blood and send it out to the National Lab Corps for any of those more in-depth tests. We can write prescriptions as nurse practitioners, physician assistants, and our physician. We can write prescriptions and we can send those to a local pharmacy. So for routine stuff and all that. We provide immunizations, including flu shots every fall. We also provide liquid nitrogen for wart treatment. As I mentioned, we have our psychiatric nurse practitioner who prescribes psychiatric medication. We also consult prior to travel and can prescribe anti-malarial treatments, etc. So how it works at the Student Health Center is that there is no copay or cost for each visit, regardless of the insurance that you have. So we are funded by a student fee that you pay with your tuition. So even if you don't have the student health insurance, you can still come in and see us, and there's no cost for that visit. We're not billing your insurance for the visit. We're funded by that student fee. That can be a confusing point for some people. So it's really important that you know, like, you don't have to have the student health insurance to come see us. Anyone can come see us regardless of their insurance. This fee also covers any testing or treatment provided within the health center. So like those rapid tests I talked about, we have a small amount of medications like antibiotics and stuff that we give in the health center, and those are all covered. The exceptions to this would be immunizations, anything ordered outside of the Student Health Center, so specialists or those labs we send out to LabCorp, that would be when you utilize your insurance. So I always recommend people have their insurance on them when they come into the health center. So really important, and you'll hear our counseling colleagues talk about this as well, is confidentiality. If your student is over 18, the Student Health Center does not release information to anyone regarding that care unless they have a written release. So your standard release of information. We, so just so people know that, because that can be a change from prior care. And then the Student Health Service also encourages communication through our secure electronic medical record. So we have a health portal, like many of you maybe are already familiar with, and that's how we primarily communicate with students. This is where I'm going to talk about immunization requirements in a second, but this is in that health portal is also where you're going to find all of the communications regarding your immunization compliance as well. So just a little preview on that. As Andrea said, we also do have a dental clinic on campus. It's located on the second floor of the Wellness Center, and they require appointments. So you just, on our website is how you make an appointment. And they do routine dental care and preventative care, so exams, cleanings, fillings, etc. More complex care or like wisdom teeth removal, implants, stuff like that is referred to specialists in the community. They also do not accept any form of dental insurance, and they are a fee for service model with pretty significantly discounted prices compared to the community. So all their prices and their process is listed on the student health insurance website. So that's a great place if you're interested to go. Okay, so immunization compliance requirements. So those immunizations you see in red are the ones that are required. And this is a state of Colorado requirement. This is not just a Mines requirement. This is what the state required that we obtain. So the required immunizations are 2 MMR vaccines or a titer documenting immunity. You have to fill out a questionnaire to determine if you're at high risk of tuberculosis. And then the meningococcal ACWY within the last 5 years if you're living on campus only. There is exemption and waiver information on our website if that's a process you want to explore. So just check out our website because there's a very specific process for waiving those requirements. Other recommended immunizations would be the meningitis B, an updated COVID and flu vaccine, and then just being up to date with your other routine vaccinations. So how to provide this information. So you see the whole steps there if you want to take a screenshot or a picture. That's a really good step. It's all on our website as well. But you want to sign in to my.mines.edu, click on the Medicat Health Portal icon, enter all your dates, and then critically, you have to remember to upload documentation to support your immunizations. You can't just enter the dates. We have to see a record from your healthcare provider or a state immunization compliance system um, to support those dates. You can't just upload the date. Then you click on the Forms tab, fill out that tuberculosis screening questionnaire, and then if you need to provide a test result, you can upload that in the same process. Again, our website is the most important place to go if you have any issues with this, but that's just an overview of the process. So we do recommend coming to campus with like a little medical kit, just to kind of ease your transition. You know, living in dorms and living in close quarters with roommates, sickness definitely does happen. So digital thermometer, Band-Aids, first aid kit, a rapid COVID test and flu test can be helpful. Those are both available over the counter now. And then just any medications you typically take when you're sick, and to make sure you come with enough prescription medication to get you through the first couple months so you're not scrambling. So, more about daily prescription medication. Again, arrive with enough medication for a couple months. But if you are kind of in a bind and refills are needed, call the student health center as soon as you're running low, and then you can meet with a healthcare provider. We can review your history, and if it's medically appropriate, we can go ahead and refill that medication for you. It's always super helpful to have medical records, so make sure that you have those if needed. For ADHD medications specifically, stimulant type medications, your Adderalls, your Vyvanse, Concerta, there is a very specific process for that, which is listed on our website, and you can read it there. But there's a lot of detail on our website, and that's a pretty common practice for college health centers to have those requirements. So just make sure you read those closely and send those records to us if you're looking to get your ADHD medication on campus. For after hours care, just know that we are open regular business hours and we're closed when School of Mines is closed. So if it's a holiday or a snow day, we close as well. Um, as Andrea talked about, we have that wonderful academic live care. And then there's also a list of local urgent care and ER facilities on our website. This is our social media. And you can go to the next one. And if there's any questions, go ahead and throw them in that Q&A and I'll stay around for afterwards. Thank you very much.
Thanks so much, Kelly. I appreciate it. And I know we've got some good questions coming for you later on in this webinar. But we're going to go ahead and keep on rolling. And we're going to come next to our Minds Counseling Center. So I'm going to introduce Katie to talk a little bit about that.
All right. Hello, my name is Katie Parsons. I'm the clinical outreach coordinator here in the Minds Counseling Center and one of the licensed therapists. We are located in the Wellness Center directly above the health clinic on the second floor. Our hours are very similar to the health clinic, generally 8 to 4:45 p.m. Monday through Friday. Again, like the health clinic, if campus is closed, we are also closed. We do not have we don't have 24/7 services here. We will talk about that a little bit later as well. Generally, we have around 11 licensed clinicians on staff here to meet with students. We also have anywhere from 1 to 4 master's level interns during the school year that are here to help out. We also have a great support staff that includes our admin assistants as well as a care coordinator to help students get connected to community resources as needed. We've got a lot of experienced clinicians here that offer a wide variety of expertise to help the students here at Minds. Some of the counseling center basics here. Our services are included in the student fees as part of the tuition, just kind of like the health clinic fees. We do not have services that would require any additional costs. Our services are confidential, like the health clinic, and voluntary on the part of the students. It is important to note that we do not mandate students to utilize our services. And if a student has not met with us before, we are not the ones that are able to do any outreach there because of our confidentiality rules and laws, which are similar to the health clinic. As far as our scope of care, we offer a multifaceted care model within our center. We're going to talk a little bit about that later. And we do utilize community and online referrals and programs for students who are experiencing ongoing, complicated, or need some specialized counseling for their concerns. Again, all of our providers include licensed counselors, licensed psychologists, and licensed social workers. So a lot of times people are curious as to what are the reasons students come to the Mines Counseling Center. The numbers here are from the academic year of 2025, just to give you an idea. Anxiety is always the biggest concern, and that's been pretty consistent year after year, as well as being consistent from one university to another. That's typically the highest request. You'll notice that the numbers here don't all add up to 100% because oftentimes students are marking multiple presenting concerns when they're initially contacting us for services. Our multifaceted care model seeks to meet students where they are in the change process while also promoting autonomy and empowerment with the services they're seeking. We take the most clinically effective and efficient interventions and then offer partnership with students to best meet their unique needs. Students are coached in creating connections within the Mines community as well to support their ongoing thriving and belonging. This model allows us to offer quicker access and a variety of ways that we can support students and stay connected with students, even if they are referred to off-campus services in the community. Students can still continue to use some of our other services besides the individual counseling. We offer both in-person options and virtual options to connect with students. In our in-person offerings, we offer short-term individual therapy sessions, case management. We have graduate and undergraduate support groups that students can just drop into each week. We also offer in-person skill building, educational series around, anxiety, stress management, some of the typical concerns that students come in with. And then we also offer additional therapeutic groups that do require meeting with a clinician before somebody can attend those. That includes our DBT group, RODBT group. We also, when there's a need, we might have other types of support groups, like a grief support group if we notice we are getting a lot of students with some common concerns coming up and seeking help. Most of the things that we offer in person, we also offer virtually, the individual counseling, the case management. Life hacks are strictly virtual. Those are just 30-minute little workshops. We do offer drop-in office hours a couple times a week. And then we do also utilize academic live care, which is entirely online. And that was mentioned earlier. So that includes telehealth, telepsychiatry, nutrition, as mentioned earlier. So those are options. Those are also good options. Academic live care, if a student wants to meet with somebody while they're on break and they live in another state, students can request sessions with somebody licensed in the state that they're in when they're seeking help. So we try to make it easy for students to get connected to us by any number of ways. Students can call, they can email, they can schedule online. They can drop in during our virtual office hours and talk to a clinician. Once they've initiated contact with us, then we schedule the student for an initial phone consult with a clinician. Here we help the student make a plan for care, what next steps are. That could include utilizing some of the group services. It could include signing up for some of our educational skill building groups, as well as scheduling a few sessions or getting them connected with our care coordinator or with a provider in the community. It's important to note that we don't have session limits. So students are encouraged to revisit us for check-ins or if new concerns come up, so we can continue to offer support. Again, it is a short-term model. So, each time we're just meeting with them, maybe for a semester at a time, for each concern that they're dealing with. We also want to note, just like with the health clinic, in order for us to have any contact or coordinate with any on or off campus care or resource partners, we do require a release of information signed by that student who is receiving our services before we can release any information and coordinate care with them. We have some tips here for incoming students that might save some anxiety and stress down the line by getting ahead of things. The first I want to mention, if somebody is utilizing therapy now and it's going well and it feels good to have a therapist that they can go to regularly, you can consider reaching out to the counseling center, going to the care coordination website, and you can find and look at community providers if your student wants to have a therapist for long term. You can go to the website and find some of that and reach out to the community, whenever you're ready to do that. If in the past you've had accommodations for something like anxiety or ADHD, we really encourage you, whether you plan on taking advantage and pursuing any accommodations through disability services, that you meet with them at the beginning of the year, get things set up, because it's much easier then to go back and actually get the accommodations. If later in the semester they tend to get a little bit backed up with people wanting to reach out for those services. Again, explore academic live care. After August 1st, you guys have access to that. And then also I want to point out the student outreach services. This is where, like I said, we don't reach out to students who we don't already have relationships with. However, if you are concerned about your students' mental health or concerned about them for any reason, as student outreach services would be the place to go to have somebody follow up with that student and reach out to them. Some additional tips here for the students. We really encourage students to introduce yourselves at the very beginning of the semester to your professors or instructors. Introducing yourself, being a familiar face makes it a lot easier going in to ask for help later, or if you need extensions, if they already know who you are. Of course, write down test dates, project due dates, as soon as possible after you receive your syllabi to help you keep track of everything that's going on. Staying organized can definitely save a lot of stress later in the semester. As far as your well-being goes, it's important to establish and plan what is your daily schedule, including making times and scheduling your sleep schedule. Make sure you're getting enough sleep. When are you going to eat between classes? Do you need to bring snacks between classes? When are you going to do some of your self-care exercise, or social activities? If you can get on a schedule, that can be really helpful too. And then lastly, we always encourage everyone, ask for help sooner than later. Don't wait till you're failing a class to seek tutoring. Or wait till you're really far behind and stressed out and come into counseling about stress and anxiety. If you can reach out sooner, it's always a little easier for the different services to help figure that out. Some additional resources I wanted to share with you all. You at Minds, that I think that'll probably be talked about by our wellness and promotion, but we like to promote that. It's a digital platform, and it offers articles, advice from everything from how to make friends, how to keep friends, to updating resumes, to improving sleep hygiene. There's lots of good information around general wellness there that all students can access, and it also connects to campus resources. Colorado Crisis Services, I mentioned that we are not a 24/7 crisis clinic here. Our counseling center does refer after hours and weekend if you are in need of mental health services, to contact Colorado Crisis Services or call and text 988. Again, you don't have to wait until you're in crisis. You can call when you're starting to feel a little bit anxious on a weekend and get help then and talk to somebody as well. And finally, our counseling resources. On our homepage, we kind of beefed up a tab with a lot of resources that include different campus resources that would be helpful, as well as, how do you, the trainings, the suicide prevention or mental health trainings that are offered. We have online resources, identity related resources, and that can be anything from, resources for first gen students, resources for veterans, resources based on your particular race or ethnicity, as well as resources that include for food insecurity and housing resources. On that tab, you'll also find out more information about how you can support your student and the FAQs about the Minds Counseling Center. So I encourage you all to visit and explore our website for more information. Like Kelly said, there's a lot of information that is there for you to get more details. If you do have any questions about our services, you can definitely reach out to us at the Minds Counseling Center via email or phone call if you have questions. And we also are on social media in the following platforms if you want to follow us on there.
Awesome. Thanks so much, Katie. All right. Last but certainly not least, we're going to talk a little bit about health and wellness promotion. So I'm going to hand it over to Molly.
Hi, everyone. I hope you're having a good summer. My name is Molly. I am an assistant director in student wellness promotion and education. And just like everyone else on this call, the student wellness promotion team is located in the Student Wellness Center on the second floor across from the counseling center. Most of what I will be talking about today, you can find on our website, which is noted there. Great. So, unlike the other services, you will most likely see our staff and our student workers on campus, tabling, doing workshops. We are open in the office Monday through Friday, 8 to 4:45 p.m. If students do want to come in and chat with us. But a few of our programs and services that we offer, as Katie has said, all Minds students have access to our You at Minds platform. This is a 24/7 resource. So if students have questions about their sleep, nutrition, anything under the sun around health and well-being, they can find articles to just learn a little bit more. and they can set goals for themselves around their health and well-being, as well as take assessments to just see how they're doing. So once you have your Minds email, you are welcome to sign into that platform. And then also we have our peer education program. This program you can apply to once you have gotten through your first year at Minds. Our peer educators are trained to put on programming and tabling around a variety of health and well-being topics, alcohol, sexual health, healthy relationships, nutrition. And so this is a lot of the times where students are interacting with us the most and getting some great information from their peers. Other trainings and workshops and events that we do are around mental health, resilience, stress relief, suicide prevention, and alcohol and drug use. So again, within all of our departments, we share the Wellness at Minds Instagram account. So feel free to follow that to see the upcoming events that are going on in our department as well as the other ones on this call. We do have two required educational pieces through our department. The first one is an online prevention course. You have the alcohol education and the sexual assault prevention course. Both of these students will receive a notification through their Minds email later this summer. And they will have to complete that. And then we also have a required course within their core curriculum that typically students take within their second semester first year or their first semester of their second year. And this is around student well-being. It's a great time to just check in with yourself and just see where you're at around all these topics, as well as get reminders of the resources available on campus after you've had a semester or a year under your belt. So that will be, again, completed within your core curriculum. Last but not least about our department, one of the most exciting and fun pieces that students do come to our office for is our blaster boxes. So these are physical boxes, as you see here, that are free to students. You just have to request it through this link here. And there are boxes on a variety of different wellness topics. So there is a belonging box, so to help students kind of navigate their social well-being, make friends. There's educational tips as well as physical tools, as you can see in the upper right photo there. There is like a sick box. So if you're feeling ill and need, a thermometer, some food and all that jazz, you can find that in that box. We have our backup box for alcohol and drug use, our sexual health box, and a lot more. And again, students can request this for free through our website, and they can request multiple ones for the variety of wellness topics here. And as family members, if you find that this is a very useful program for your students, we always are accepting donations. Again, this is a free program and we want students to have access to this whenever they need it. So if this is something that, you see is helpful for your student, you can go to that website as well and donate if you would like to help support us as we disseminate these boxes across campus. And that is it for student wellness promotion.
Awesome. Thanks so much, Molly. All right, I'm gonna invite all of our panelists to come back on, and we're gonna go ahead and jump into some Q&A with the questions that you all have been asking. So I'm gonna kind of just go through the list of everything we haven't answered yet in the chat. I might try to combine some questions just in case we're running short on time, things like that. But let's go ahead and dig in. I think the first one that I wanted to go through really quickly was talking about like the cost for healthcare on campus. So kind of the difference between SHIP and then the services covered by the health services fee. So I'm going to combine two. And the two questions here, and Andrea and Callie, I feel like this would probably be you all's expertise. But so just confirming that the costs are not included in student fees. Like, is there an additional cost? And can people see what those costs are? And then the second question for this one is what is the difference between SHIP insurance and the services offered by the health services fee through the health center?
Andrea, I can take a quick, and then you add on anything that I
Okay,
missed.
yeah, I was gonna say I can answer part
Yeah.
two.
Um, so as I said, so the student health insurance plan is exactly what it says. It's an insurance plan. It's like you having your own Blue Cross or Kaiser or whatever insurance plan you have. So that is your health insurance. What the Student Health Center, how we kind of operate and what we're funded by is a fee that you pay as part of your tuition. So everyone enrolled in at least 6 credits pays this fee, and that's how we run our clinic. So the student health fee is just at Mines. It's just in the Student Health Center at Mines, whereas the student health insurance plan is what you typically think of more as a regular health insurance that you can use in many different places. So we're funded by the student health fee, and that allows us to have the visits at no cost. That allows us to do our point of care testing, to dispense the medications that we dispense within the office. All of that is paid for via that student health fee. Whereas the insurance is you pay your premium and then you have your different levels of insurance and coverage within that. So that's the difference between those two things. And at the health center, we're not billing your insurance for the visit and the point of care testing and the medications we dispense because that's paid for by the health fee. If we do need your insurance, it's because we're sending either your lab samples or referring you to a specialist or for x-ray outside of the health center. And that's when you use your typical health insurance. So it's the most confusing part about our services for sure. So I'm not surprised there's questions about it. But that's kind of the difference from my perspective as a provider in the health clinic. And then Andrea, of course, anything to add, please add anything that I missed.
Yeah, so there seems to be confusion each year about, well, I waived SHIP, so does that mean I can't go to the health center? No, the two are completely unrelated. So, like Callie said, the health services fee, that covers things in the health center building. So that means you can go see the counseling center for free. You can use wellness promotions. You can go to the health center. All those things are under that umbrella. SHIP is its own thing. It's the only fee you can waive. So if you already have your own health insurance, great, waive SHIP and you're done. But you can still go to the health center if you waive SHIP. If you choose to be on SHIP, even better, then you'll have a nationwide plan through United Healthcare that has in-network providers all across the country. Hopefully that clears that up.
And do either of y'all happen to know, is that health services fee covered by the VA? No.
I
You,
don't,
you'd have to ask the bursar
Okay.
about,
yeah, that's
or
more of a
maybe financial aid. I don't know.
Yeah,
Okay.
yeah, because that health service fee is like lumped in with a bunch of other fees. It's like a
Like
student
the rec center
activities
and stuff.
fee. So that would be definitely a bursar question for
Okay.
sure, or
Perfect.
financial aid or whatever. Yeah.
Great.
And I just wanted to add on to that as well, that when we also refer to the community, that is, that's where students also would be using SHIP or their own insurance if they need a counseling service that we're not able to provide here as well.
Awesome. All right. I'm going to combine another two. And this one's specifically around immunizations, because I see we're getting some questions around that. So kind of in a couple of different ways. So can a student just upload a PDF with their immunization records instead of filling it out in the health like portal dropdowns? And then on top of that, can they also get one of the required vaccines at the health center when they get to campus, or do they have to have that ahead of time?
Yeah, so I'll try to also combine multiple questions that I'm seeing here as well. So the technical date for submission of your immunization records is June 15th. And the reason for that is we have to manually, a person has to look at all of the dates and confirm all the dates with the records that you upload. And that's the bulk of the work we do over the summer. So in addition to submitting the dates on the Medicat portal, you must also upload the PDF. You have to do both. You cannot just do one or the other. So you can't just upload the PDF and then we'll enter your dates for you. And you can't just enter the dates without any documentation. So you must do both. So that's really important. And like I said, the bulk of the work we do over the summer is that we manually review all of these records to make sure that they're in compliance. So the date is June 15th. There is a little bit of like wiggle room if like, I saw someone saying that they're still waiting for records and things like that. You're not going to get kicked out of mines if you don't have it on June 15th. What we really want to make sure of is that the campus community is covered by these immunizations before they step on campus. So that's our goal every year, to have these kind of process before they get on campus. So if you're still waiting on records and you submit it next week, nothing terrible is going to happen to you. But we really, really would like everyone to do it by June 15th if possible, just because we do have to review all those records and that takes us a significant amount of time. In regards to receiving an immunization on campus, we do stock the MMR, we do have the meningitis, and we are able to do TB testing on campus. Like I said earlier, though, if you can do it before you get there, it's just one less thing to do on a very, very busy time of year when you're first coming to campus. So we prefer you do it before you come to campus, but we recognize that there's issues with insurance or access to it. Like some of our international students sometimes don't always have access to the immunizations, or even some of our US based students. So in that case, yes, we definitely can do it once you get on campus, but we prefer that you have everything by that June 15th date if possible.
Just following up while we're on the topic, are people able to see like the waiver document and like what that looks like prior to that July 15th so they know what documentation CSM needs?
Yeah, that's all on our website.
Yeah, I would.
Sorry,
Oh,
for the
sorry. I thought
insurance
that
or
meant
for
the ship
immunizations?
waiver.
I'm
For
imagining
immunizations or for insurance, sorry.
imagine if we're looking at the July 15th, I would imagine insurance.
Oh,
That's what I
sorry, I
thought.
thought you said
Yeah,
June
sorry about that.
15th. Sorry.
Yeah, I was
No,
just
that's my
typing a
bad.
response to that. But
Sorry, Andrea.
so if you look at the step-by-step guide on our website, it shows images of what it looks like. But basically, what you need is just the information off your insurance card. You need to put in who's providing the insurance, a number they can be reached at, things like that. I mean, it's very basic. It's nothing you're going to need hundreds of documents for. You'll just need the insurance card likely.
Awesome. And while we're on the topic of insurance, Andrea, I've got a couple for you. So we'll start. Where do they ask the AHP if their health plan meets the waiver criteria?
So that's not until the portal opens on July 15th. And the student will not be eligible to enroll or waive until they receive that health fee, which for new students will probably not be July 15th because the registrar's office makes their schedules. So once the schedule is made, the student will receive an email from me that says, hey, it's time to waiver enroll. Then they'll click the link, go online, submit the waiver. It takes 5 to 10 minutes. And then within a week, academic health plans will let you know if it's approved, if they need more information, or if it's denied, and then the reasons why.
Like, can you also talk a little bit about the like waiver credits? So like how that's described. Like, is it returned to the student or is it held as like a future credit?
So everything always goes onto the student account, run through the bursar's office. All the fees that are added, all the tuition, everything just is a lumped into that thing provided by the bursar. And the waiver credit will be added just like the health fee. So it will say student health insurance fee, 2906, student health insurance waiver credit, or something similar to that, minus 2906.
Awesome.
Yeah.
Thank you. All right, let's see. This might be one for like kind of for everybody if y'all kind of want to pitch in. I imagine the answer is similar. But what happens if a student is not yet 18? What does that look like in terms of care on campus?
I can start. There is like a parental consent form that's in the that you fill out. I think it's on our website, but if you can't find it, just call the front desk because I'm not exactly sure where it lives. I believe it's on our website, but call the front desk. And it's just a parental consent form. It's like a consent to treat for us in the health center. And we just need to see that prior to the student coming in. And then we do the visit as normal. And just as general practice for healthcare providers, if a student wants us to talk to their parents, we have them sign a release. I talk to parents on speakerphone in the office all the time. So it's not like just if they're under 18, certainly we need that consent form. But even if they're over 18, if the student wants us to chat with you, we chat with parents all the time. So it's not like just because they're 18, we can never speak to you again. We just got to make sure we have all the right consents and forms.
Awesome. All right. This is kind of a dual question I'm going to ask to both Andrea and Callie both. I'm going to combine kind of two. So somebody was asking about how the health insurance plan works while traveling or studying abroad. And then the other one, similar to that, was we have a student that is going to do that first year study abroad in Europe. So are those immunization requirements the same for that program as it is for like an on-campus student?
I don't know what the requirements are for that one. I saw that question in there and I tried to look it up on their website and I couldn't find it. But I imagine they're pretty similar. These are pretty like routine type of immunizations before going to any kind of experience like this. But you do need to still submit your immunization records to us via the Medigap portal. We don't talk to that program. So if they require some kind of immunization, verification, you do have to follow our process as well. That would be the only thing I say about that. And then I'll kick it to Andrea regarding travel abroad.
Yeah, so a travel abroad and study abroad are two different things. So if a student is doing study abroad, I will be sent a list from the international office here at Mines that will say these students are study abroad. They have purchased the special CISI policy, and they'll just be automatically waived off ship for that semester. So if you study abroad in fall, in spring, you will need to either enroll or waive ship. Traveling abroad, however, if you are on this student health insurance plan here at Mines, it does not cover travel abroad, except for in a very emergency, catastrophic situation. So you would need to purchase your own travel policy if leaving the US.
Awesome. Yeah, for that first year study abroad, I would recommend reaching out to the director of that program to get more information about that for sure. Okay, let's see. We've only got a couple more minutes, so I just want to get a couple more questions in. I see a few about prescriptions. So, having out-of-state prescriptions, like can those be transferred to the health center? And then specifically on that same kind of wavelength, can you store and administer shots for allergies if they need to have those transferred from the student's allergist?
Yeah, two super really common questions. First, we do not do allergy shots. We don't store or administer those. We do refer to local allergy practices for that. You're welcome to reach out to us directly for a list of those providers in the area. And then if you're happy with your provider and you can transfer the prescription directly from your pharmacy to an in-state pharmacy, you don't even have to involve the health center. We don't have a full pharmacy on campus. So if you have a medication that you're filling at Walgreens or CVS or any of those other places, you can have your provider prescribe directly to a local pharmacy. Now, there are, like everything, there are some caveats if it's like a controlled substance or things like that. But in general, those prescriptions can be sent. If you have any more specific questions, talk to your healthcare provider that's currently providing the prescription, or if that process is like not working out, make an appointment with one of the providers at the health center. We can go over your history and kind of review everything. And if it's medically indicated, we can certainly send a prescription to a local pharmacy. So that one's like an individual basis depending on the prescription, but a lot of prescriptions can be transferred from your home provider to a local pharmacy if you want. And I think that was it.
Awesome. All right, Katie, I got one for you. I'm gonna probably make this our last question. So, panelists, if you have the ability to answer some of those, still open in chat, that would be helpful. But Katie, for you, I know we got a question about do we recommend that students have social media accounts?
Yes. Well, and not yes, we do recommend. Um, the answer is we don't make recommendations either way. I think it's important to note that there's a lot of students that get information about events. There's information sent out via social media that some students find helpful to follow social media accounts. But I also want to say that those same events, there's flyers, physical flyers on campus. There's the daily blast. There's lots of different ways that um, you know, all the different clubs and orgs put information out. So you don't need a social media to have all of that information. And it makes sense that, social media can be very distracting. We have a whole 30-minute workshop about digital overuse. And so for some people, it is best not to have social media. It's a distraction. Um, so it really is an individual basis as far as that goes. I just want to make sure everyone knows it's a good way to get information, but not the only way to get information.
Awesome. Thanks, Katie. All right, I know we are a little bit over time, so I want to get to our reminders, but I just want to give a huge thank you to our panelists for being here. I'm sure a couple of them are still answering some questions here and there in the chat, so we'll definitely keep doing that while we have this open. But if you do have any questions, this recording will be posted as soon as we possibly can to our Welcome Webinars website, and that, again, you can reference their information for those individual offices as well. You can always contact us as well. Just some quick reminders for everybody. So please be sure to join us for the rest of our welcome webinars throughout the summer. Our next one is specifically for families and supporters only. So we will be doing a current student Q&A panel. So some of our lead peer mentors will be here to help kind of answer just general questions that you have about life at Mines or what it's like to be a student, things like that. So be sure to bring your questions for that one. That one's going to be Thursday, June 26th at 4 p.m. Students, the next one that you all are invited to is the following webinar, which is, and families are invited to this as well, is our Paying for College webinar. And that's going to be Tuesday, July 8th. And that one's going to be at 5 p.m. Mountain Time. Friendly reminder for registration for these, if you haven't registered for all of them already, families, you will need your student's applicant account information to register or have them register for you to just make sure that you get that done if you'd like to register for those. Students, you should have also received an email from our lead peer mentors about the summer engagement series peer discussions. And so if you haven't signed up for those yet, definitely recommend signing up for one of those. That's a really great opportunity to not only get to know other students that are coming into Minds, but to get to know some of our upper class student leaders and get your questions answered as well. Also, make sure students to keep completing the Order Your Next Steps checklist in your admissions portal. Specifically, a specific request from our office. Please complete that Hell of a Welcome information form under the enrollment checklist section by June 20th. That helps us plan for your camp and Hell of a Welcome experience. So the sooner you can fill that out, the better. But please make sure you get that one done in the next couple of days. And then finally, just make sure you're checking your Minds email throughout the summer. More important information will get sent from our office, from admissions, and various other campus partners as well. So we're going to go ahead and wrap up with that. Thank you all so much for being here. We hope to see you at our next webinar. And as always, if you need anything, please don't hesitate to reach out. Thanks so much, everybody.